Okay, this is part 5 of back pain, Rogers theory, me, Dr. Rogers, of spinal degeneration due to ischemia, lack of blood flow, and biochemical causes of degeneration. And by the way, this is my book, Prevent and Reverse Back Pain, where I go into tons more detail about all this stuff. Here is just again showing a diffusely autofused spine from sacrum going all the way on up to the skull due to a combination of dish, interbody fusion, and OPLL. And what I'm showing you, here's like the end stage of it. These spines are very fragile. One of the things you'll notice is you see all these bulky bridging osteophytes that are intensely sclerotic, meaning that they're heavily mineralized. But deep to these heavily mineralized osteophytes, you see there's relative lucency in the bone. So this is something called the White's law of bone ossification. The more weight that's supported by the bridging osteophytes, the more sclerotic they're going to be. They're going to more mineralized they're going to be. But they're bearing the weight, protecting the rest of the vertebral body from bearing the weight, so it becomes stress shielded. It's not supporting much weight, so it's less mineralized. The point being, though, is when the person falls down or has some other vector of force like a motor vehicle crash, the vector of force can sometimes find a path between the anterior bridging osteophytes into the osteoporotic bone and cause terrible fractures. They're called chalk stick fractures because, like a piece of chalk, the whole thing just snaps. And you can see the spine here is snapped. This is the lower thoracic spine. And now the lower fracture fragment relative to the upper fracture fragment can have quite a bit of motion, and this can often severely injure the cord. With these types of chalk stick fractures, the patients are often become paraplegic, okay? So you don't want to have one of these autofused spines. I'm going to show you some other consequences. And you can see it's the same patient with a big heart, congestive heart failure. There's the pacemaker wires, you know, they got a bad heart, like AFib and CHF and all this other stuff. Okay, now I'm going to show you a little bit about ankylosing spondylitis. Ankylosing spondylitis is typically a disease of earlier onset, you know, sort of a young adult, middle-aged adult. And they form these delicate osteophytes. They're called syndesmophytes. You can see it's a smaller, and instead of the big bulky bridging osteophytes of dish, you form these smaller bridging osteophytes. And on the frontal radiograph here, by the way, this is fusion across the interspinous ligament or supraspinous ligament of the posterior spinous processes. But these sort of gentle, delicate bridging syndesmophytes is what they're called when they're thin, the osteophytes. Has a characteristic appearance called a bamboo spine appearance, okay? And the thing that's interesting is as they fuse across here, you'll tend to have less disc herniations because in a sense, this skipped the degenerative disc phase and went straight to the fusion phase, okay, due to autoimmune component of disease. Okay. What I'd recommend for all these autoimmune patients is prevent leaky gut, increase intestinal permeability. We'll talk about that at the end. Okay, so here's a lateral radiograph of ankylosing spondylitis, and again you see these anterior syndesmophytes, narrow, thin, bridging osteophytes, and you can see there's syndesmophytes bridging across the posterior part of the vertebral body, and in a sense that shuts it off, so they're less likely to get a disc herniation, less likely to have disc bulge. So that's kind of interesting. The fusion comes first, and you don't get the disc degeneration, whereas in real life, for the 99.9% of patients, it starts with disc degeneration. So that's a little bit interesting about ankylosing spondylitis. Okay, now here's a patient with ankylosing spondylitis that had a chalk stick fracture. And look at this. Boom, snap, chalk stick fracture. And this is happening lower. This patient will have severe debility. There's going to be injury to the cauda equina, but it's not quite as bad as if it had happened higher up. The higher up the cord injury, the more severe the symptoms from it. Okay, here's a typical old guy walking kind of hunched over. Sometimes it's almost like they're pushing a grocery cart. So this can be called the grocery cart sign. And the reason this happens, I'm going to show you, the spine becomes fused anteriorly, so they can't extend their spine back as well. It also, to some extent, can decompress their spinal stenosis and narrowing of the central canal a little bit with them flexed forward. But there's another reason that I'm going to show you that's kind of interesting. Here's a patient's spine MRI. You can see the psoas muscles are normally muscled right here. These are the anterior paraspinal muscle. Here's a transverse process, which is the dividing point between the anterior spinal muscles, and posterior to that is the posterior paraspinal muscles. And this is all this high signal is all fat. This is a T1 weighted sequence because the fluid is dark. So on T1, fat is bright. This is spin echo T1. Fat is bright, muscles dark. And you can see normal psoas muscles anteriorly, totally fat replaced posterior paraspinal muscles. The psoas muscle runs along the anterior surface of the spine anterolateral, and then it joins with the iliacus muscle, so it's called the iliopsoas muscle, and it contributes to hip flexion. And because it contributes to hip flexion, that's part of the reason why it's so well preserved. The patient continues to walk, okay? And also the patient tends to be contracted forward. So, and then I'll show you an example of some of the stages of that. So here's levels of posterior paraspinal muscle atrophy. So here's normal. You know, the psoas muscle and the posterior paraspinals are pretty full of bulky muscle. And this one, you still got normal psoas muscle, but you can see there's a lot of fat replacement in these posterior paraspinal muscles. Here it is progressing to more extensive, moderate fatty atrophy of the posterior paraspinals. Notice how you don't see much fat in the psoas muscles. And here's severe atrophy of the posterior paraspinal muscles. And by the way, I see this every day. Okay, this is super common. So these are these little old guys. They're all hunched forward. They can barely get their spine erect at all because it's all fused and their muscles in the back are all weak. Not good. These are the guys who fall down and they'll fracture their spine. Okay, just briefly on estrogen chemistry, because modern day people are exposed to tons of estrogen chemistry in their tap water and in their processed foods. So it's a cholesterol steroid hormone, meaning that it's got the 4-ring backbone like cholesterol. Uniquely in estrogen, you have 3 double bonds in the A ring, so it's an aromatic, and you'll have a hydroxyl group coming off it. The combination of hydroxyl group and aromatic ring is a phenol ring, okay? It's a great preservative because the aromatic benzene ring, so to speak, of the A ring gives it great shelf life stability, and the hydroxyl group makes it antimicrobial, okay? So there's tons of preservatives that are similar to this and estrogenic. And they're in tons of processed food, they're in tons of personal care products. And a typical way they trick the consumer is people started to figure out that bisphenol A, called BPA, was very toxic. Okay, it's a mitochondria inhibitor and it's also a powerful estrogenic. So they said, we don't want this in our plastic. We don't want any BPA. So the company goes, sure, we'll get rid of BPA. And they just put a sulfate group in the middle, so you still have the 2 phenol groups, so it's still highly estrogenic. So they can always do that in some form, switch out the chemical. So don't ever think you're going to legislate a chemical away. You got to just learn how to avoid stuff. Put your water in glass. Don't use these plastic bottles. All right, so when the body excretes estrogen, the liver conjugates it to make it more water soluble, and it'll add a glucuronic acid to it. So E is for estrogen. This is the glucuronic acid added to it to conjugate it in the liver, secretes it into the bile, and normally we'll defecate that extra estrogen out of our body in the stool. But if the person has a lack of dietary fiber, then they get bad gut bacteria. The bad gut bacteria have more of an enzyme called glucuronidase. And the glucuronidase will cut the conjugation. It will remove the glucuronic acid from the estrogen. And once that is removed, then this estrogen will be reabsorbed into the blood. And so the person will have higher estrogen levels. So this is another reason why you definitely want to filter your tap water. All it takes is a carbon water filter to get these estrogenics out of your tap water. And then you want to be a minimalist. Minimize your use of personal care products because, you know, most of them have some type of estrogen in them. And eat your plant foods to get your dietary fiber. You want to avoid leaky gut. You know, there's lots of things that cause leaky gut. And then you get all these secondary problems of amyloid clotting in your blood. I give an entire lectures on all this stuff, but the bottom line is eat your plant foods to get your dietary fiber. They feed the good gut bacteria. The good gut bacteria convert the fiber into short-chain fatty acids, in particular 4-carbon butyrate, that's used by the gut lining cells, enterocytes, to make TJs, tight junctions, that prevent leaky gut, increased intestinal permeability. If you have leaky gut, bacterial toxins can get across, like LPS from gram-negative bacteria, LTA from gram-positive bacteria, and they will change the shape of the blood-clotting protein fibrinogen to undergo an amyloid transformation, whereby its secondary protein structure changes from Alpha helix like a cylinder, the beta pleated sheet flat, stacking up like a deck of playing cards, and that will form clots, okay? They're called amyloid clots, meaning that they're a distorted shape of clot. Instead of being like little pieces of spaghetti, they're like dense matted deposits. They're refractory to lysis, meaning they're harder to dissolve. They're more likely to permanently plug up your arteries and give you brain damage, heart damage, spine damage, okay? There's lots of things that cause leaky gut. Eating high-fat diets, omega-6 oils, excessive amounts of saturated fat from eating animal foods and dairy, excessive psychological stress, caffeine, alcohol, emulsifiers in processed food, BT corn, non-organic corn, dishwasher soap. You don't need dishwasher if you're cooking without oil. You just rinse stuff off with water. Okay, and there's a whole bunch of other things. Some of these artificial sweeteners, aluminum in tap water, HG potentially even from amalgams or from other sources. Traumatic brain injury, stroke. Brain injuries will also cause leaky gut, and it'll cause leaky blood-brain barrier. So there's a whole bunch of other things. Poor dentition, you can get them from the mouth too. Mouth bacteria can get into the blood. This is just showing that the LPS and LTA bacterial endotoxins distort the shape of fibrinogen, the blood clotting protein, from alpha helix, cylindrical like a slinky, into beta pleated sheets, flat like a deck of playing cards. They stack up, bind together, and they clot, precipitate in the blood. Excessive free iron, and the average male in the Western world is iron overloaded by his mid-20s. Average woman, her late 50s, because they fortify a lot of the food with iron, and people eat a lot of meat that's high in iron, so they become iron overloaded. It does the same thing, causes increased clotting. Not good. That'll increase your risk of becoming dementia, AFib, CHF. Here's a guy by the name of Chris Knob. He's an ophthalmologist. The only reason I show this is there's a lot of high-fat, phony BS artists trying to pretend that omega-6 oils are good for you. It's an absolute disgrace of a joke. And this guy, yeah, he's a little biased. He thinks meat's okay, but I'm just showing you that there's tons of data to show that omega-6 cooking oils are really bad for you. And these guys who are trying to promote them as a health food should be ashamed of themselves, in my opinion. So anyways, Chris Knob showed that the biggest correlation with obesity was the increase in vegetable oils. And of course, the increase in obesity correlates with hypertension and diabetes. Not good. And then, simple concept. Look at life. It's a little bit like a video game. These are Super Mario Brothers. You go through the obstacle course of daily life. And if you do the good thing, you get the green energy points. You do something stupid, you get the red, and you lose energy points. So you want to do everything right to the extent you can control it, to the extent you know what to do. Eat the good foods, get good sleep, manage your stress, be religious, okay? Avoid the bad foods, avoid alcohol, cigarettes, processed food, non-organic food, okay? All oils. All these, processed foods, they try to make them with the so-called bliss point, where they do a test audience and get just the right amount of MFG, monosodium glutamate, manufacturer-free glutamate, salt, fat, frying it, high fructose corn syrup, things to make it feel right in your mouth texture, and they hit the so-called bliss point, where people are most likely to find it hyperpalatable and keep overeating it, which makes them fat and sick. The sickest, fattest populations are the ones that eat the most processed food. Okay, here's manufactured-free glutamate. It just means that you take a protein and you process it more and more, which breaks it up into the individual amino acids, beginning with a protein high in glutamate, and then you will thus manufacture high levels of free glutamate, because that's what activates the positive, enjoyable taste receptors in our gut, and they trick us into thinking some crappy old stale food is good. So you don't ever want to eat this stuff. That's why I only eat single ingredient foods. And I said it before, take your pick. You can live your life God's way or man's way. God's way is eat the simple plant foods like Genesis 1:29. I put every plant on this earth that shall be food for you. Things that Adam and Eve could eat in the past. Single ingredient plant foods. That keeps you healthy, okay? And avoid some of these toxins we talked about, like filter your drinking water, avoid personal care products as much as you can. And you got a good chance to make it to 90. There's no guarantees. But the more you live in that direction, the more likely you are to at least make it to your mid-80s. If you go down the path of the typical chump, eating a lot of meat, oil, processed food, and you go into conventional medicine, you get pill after pill, drug. The pills stop working, you get worse, then you go for surgery, chop, bye money, dead at around 70. How to improve blood flow, we talked about that. Eat a single ingredient only, whole plant foods, organic only, no added oils. Minimize dietary sodium. I don't add any sodium to my food. Walk a lot, get your sunshine, manage your stress, be religious. Here's just an example, like in my old house, I would come home from work and then I would walk around in circles. There was sort of a big circular area. And I enjoyed doing that, and I would do some reading at that time. You know, that was a typical thing. And walking is really good for the spine. So anyways, that's it for part 5 of back pain. You know, Roger's theory of spinal degeneration, ischemic and biochemical. I hope you found that helpful. If you want to learn more about the spine, you can read my book, Prevent and Reverse Spine Disease. So anyways, I hope you found that helpful.